At the onset, I want to commend this subcommittee for its groundbreaking work on antitrust issues, and also to acknowledge the historic work of my friend and colleague in the Senate, Senator Klobuchar, and her heroic work in fighting rising prescription drug prices. The former chairman of my committee, the late Elijah Cummings, cared deeply, as I do, about the issue of rising prescription drug prices. He understood that drug companies' exorbitant prices have devastated patients across our country, forcing many to make gut-wrenching choices between affording their medications and paying rent, buying food, or saving for retirement. For this reason, at the beginning of the 116th Congress, Chairman Cummings launched an in-depth investigation into some of the largest and most profitable drug companies in the world. This investigation has remained one of my highest priorities since I took over as chairwoman. Over the last 2 years, we have reviewed over 1.3 million pages of internal company documents. Last fall, the committee held hearings with 6 CEOs and released 5 staff reports summarizing our initial findings. Before I describe some of these findings, I want to recognize that we rely on the pharmaceutical industry to develop critical new therapies, cures, and vaccines. In exchange, our system grants these companies the exclusive right to sell their products for a limited number of years without facing competition from lower-priced generic and biosimilar drugs. Unfortunately, brand-name drug companies have abused this system by engaging in blatantly anti-competitive strategies to extend their monopoly pricing for far longer than our system intended. Our committee's investigation found that these strategies, combined with laws restricting Medicare's ability to negotiate directly for lower prices, have emboldened drug companies to target the United States for price increases while cutting prices in the rest of the world. Our system, in essence, is leading to higher and less affordable drug prices right here in the United States. In addition, our investigation found that pharmaceutical companies dedicate significant portions of their research budgets to coming up with new ways to suppress generic and biosimilar competition, rather than focusing on developing new therapies. By allowing these anti-competitive tactics to continue, we are paying more money and getting less innovation. Our investigation exposed the inner workings of the types of anti-competitive conduct your subcommittee is seeking to combat. Here are just a few examples. One drug company, Teva, engaged in what is known as product hopping, using its monopoly market power to shift patients from one dose of its blockbuster MS drug, Copaxone, to another dose before generic competition for the first dose comes to market. Experts estimate this one product hop cost the U.S. health system $4.3 billion. Another example, companies such as Amgen and Novartis entered into patent settlement agreements with potential generic competitors to delay their entry into the market. Amgen internally estimated that it collected $202 million in extra sales of the kidney drug Sensipar by delaying generic entry by just 10 weeks. Experts estimate that Novartis' delay of generic competition for its cancer drug, Gleevec, cost the U.S. market over $700 million. The last example I have is executives at another company, Celgene, discussed how to leverage the high price of its cancer drug, Revlimid, to prevent other competitors from conducting productive cancer research. Our committee's investigation also revealed damning details about other abuses, like patent thickets, misuse of the Orphan Drug Act, and exclusionary contracting with pharmacy benefit managers. I encourage members and the public to use these reports as a resource as they seek to combat rising drug prices in our country. I want to end by emphasizing that we are not done. My committee is continuing to investigate abuses by the pharmaceutical industry. On May 18th, the committee will hold a hearing with the CEO of AbbVie. AbbVie sells Humira, the highest grossing drug in the United States and the world. The committee has obtained internal documents, previously not public, that show that the tactics of AbbVie has used to suppress competition for Humira and other drugs and maintain monopoly pricing in the U.S. I hope the Oversight Committee's findings are helpful to the Judiciary's committees as you consider legislation to address the pharmaceutical industry's anti-competitive practices and unsustainable, unfair, deceptive price increases. Thank you. I appreciate the opportunity to appear before you today and congratulate you on all your hard work in this area. And I yield back.